Hello. In this final activity, you're going to analyze data for tuberculosis trends. So we've been analyzing this for the past four assignments, so we're going to complete that activity today. So let's get started on this. This is what the activity looks like that is attached to your weekly work. So we're going to be analyzing this. We have a PowerPoint that will present this information. So let's go ahead and get started on this PowerPoint. And here we go. Tuberculosis rates worldwide. TB rates are higher in poor regions of the world. So you should have your activity out next to you, and as we go through this, you'll be answering the questions as we go. So the first question is, which of the following countries have the lowest TB rates? So you can look at this chart and figure that out. Let's go ahead and name some of these countries for you. So, well, before we do that, TB incident rates are very low in countries that can afford to have access to health care for its residents. So the U.S. obviously has a high economic, and so we have good health care, and so low TB rates. This is Africa, which doesn't have a great economy in some places, and so obviously we don't have healthcare problems. Russia, same thing. That's China right there. Australia, which has a pretty good economy. Canada, again, good healthcare. New Zealand, and again, this is New Zealand right here, so make sure you see that, and it's one of the best places in the world to live. South America. So these are the places that you can list, or I think is on your list, and you have to pick which ones have the lowest TB rates. Okay. Recognition that TB depends largely on social and economic determinants of ill health is crucial to achieve full control. Right. So again, TB is a infection that happens in the lungs. It is a bacterial infection. The bacteria can become resistant to antibiotic drugs. One of the main reasons for that is that when you're treating the TB bacteria, you need to treat it for the full course of time, which can be a lengthy time to treat this bacterial infection. So next, make a claim that would explain why these countries have low rates of TB. So why do the countries that have low TB rates, why do they do that? You're just making a claim based on what you've learned from before or what you're thinking of right now. So stop the video if you need to. We're going to move on. Okay, next, list 3 contributing factors that can cause an increase in TB incident rates. So 3 factors are smoking, alcohol abuse, diabetes, which is blood sugar problems, indoor air pollution, malnutrition, HIV. All these are impacting on TB epidemiology, impeding faster progress towards control. All right, so usually if you have alcohol abuse, you have other health issues. If you get TB, the alcohol abuse is going to affect other parts of your body. The TB is just going to be easier to infect because of that. Same thing with diabetes. Diabetes is a disease where you're going to have other health issues, and TB is going to be more easily to get in you and to hurt you. Indoor air pollution, obviously, if you have indoor air pollution, you already are going to have problems with your lungs, and TB is just going to make that worse. Okay, malnutrition, if you're malnourished, TB will be able to easily infect you, and also you're more likely to get it because of factors that go along with the malnutrition. And HIV, you're going to learn about as we move through this PowerPoint. So treatment success rates. So again, this graph shows treatment success rates as of 2011. So you can see which countries are having a very good success rate with treatment and which countries are not. And again, some of the countries, like the United States, you can see is not having great success, but that's because our incidence rates are so low. So the people who are being infected, we're not having much success with them as in other countries where they might have had a high TB rate, and then the success is much higher right now because of this. So Preventable strategies that may result in remarkable outcomes among certain vulnerable groups, such as people with diabetes, those infected with HIV. Reductions in levels of smoking, alcohol abuse, malnutrition, and indoor air pollution will likely be associated with reduction in TB infection. So again, it's these two main groups are the ones that worry about, the diabetes and the HIV. That TB seems to really hit those groups strongly. If you have those, you're more likely to get HIV in certain areas of the world. So why is the incidence of TB higher in people with HIV? Well, HIV is a human immunodeficiency virus. HIV attacks the body's immune system, specifically the CD4 cells, T cells, which help the immune system fight off infections. So if HIV is affecting your immune system and you're exposed to HIV, your immune system can't fight it off naturally, and so obviously you're going to have a harder time fighting or staying alive when this disease hits you. Ultimately, education, health promotion, universal health coverage, poverty reduction strategies will have an effect on TB epidemic by progressively removing individuals from the vulnerable pools. So that'll be the best way to fight the TB, is by having health promotion, universal health coverage, or some kind of coverage where more people have access to health. Poverty reduction will have that biggest effect. So one of the problems we're having in the United States right now is we have a lot of homeless living in encampments. And again, TB, that's a hotbed for, if they get TB, they can just spread it between them. Which of the following countries are having high treatment success rates of 85 to 90%? So you're looking down here, 85 to 90%. Which countries show that? Well, there are two countries we haven't named. So Latin America, which is these countries right here, Mexico, and then India over here. So if you go back to your last slide, you can see some of the other countries that might be having a hotbeds. What does DOTS stand for? So DOTS is directly observed treatment, short course. DOTS, also known as TB DOTS, is the name given to tuberculosis control strategy recommended by the World Health Organization. So that's the strategy they're trying to use to decrease TB worldwide. So there are 5 main components to DOTS. So which of the 5 components of DOTS do you think is the most important? So let's go through these 5 components. First component, government commitment, including political will at all levels, and establishment of a centralized and prioritized system of TB monitoring, recording, and training. So again, the government has to be willing, have the money and the will to make this happen. It's got to be one of the priorities. Case detection by spectrum smear microscopy. Basically, those are spit tests. So you spit, in your spit there'd be TB. So it's just who is infected, and if they are infected, let's get them treatment, or let's get them into a facility where they are not infecting other people. Standardized treatment regime, directly of 6 to 9 months observed by a healthcare worker or community health worker for at least the first 2 months. And again, this is the problem, because it is a long time to treat this. And if you are a person who is poor or does not trust the government, you may not be able to stay the full course 6 to 9 months. And if you don't stay the full course 6 to 9 months, then all you're doing is making TB resistant bacteria, right? Because you're killing off the ones that are less resistant to the antibiotics when you start it. But if you don't continue the course, then the more resistant ones are left in your body. Drug supply, you have to have a good drug supply. These drugs are not always cheap, these antibiotics, so you have to have a supply of that, which again goes back to government commitment and money. And then a standardized recording and reporting system that allows assessment of treatment results. So a way to find out if your program is working. So these are the DOTS that the World Health Organization recommends to help eradicate TB. And again, it is dependent on government, on money, and on supply. And again, also on a relationship with the people that you're treating, all right, and programs that will help them. Explain why you think it's most important component. So choose one of these and tell me which one of these is the most important component. Give me a claim why. Multi-drug resistant cases. Okay, so the question is, which of the following countries has the highest rate of MDR, multi-drug resistance to TB, multi-drug resistance? Okay, so here's your percentage of cases in the world. So percentage of new TB cases based on the most recent year for which data has been reported, which varies between countries. Countries and territories shown in white have reported no data, right? In Brazil, Spain, Central Africa, Republic, Russia, Turkmenistan, India, Malaysia, Indonesia, drug resistance surveillance data was only subnational. So again, this information is based on reporting. All right, so percentage of cases, all right, high cases, low cases. We want to know which of the following countries has the highest rate of MDR. Yes, we have Latin America, we have Russia, and we have China. So the US, Latin America, Russia, and China. Make a claim that would explain the high rate of multi-drug resistant TB in this country. So whichever one has the highest MTBR resistance, make a claim based on that from what you've learned before or from the dots. TB dependency largely on social and economic determinants. Factors such as smoking, alcohol abuse, diabetes, indoor air pollution, and malnutrition. So that concludes this activity. If you have any additional questions, please see your science teacher, and have a nice day.